Good morning, Mr. Smith. How are you feeling today?
Good morning, Dr. Alex. Sincerely, my condition has improved. These days, I'm really worried about my health.
I get it. Together, let's review it. Your most recent test results are here. Could you please elaborate on your symptoms and the period of time you have been having them before we get started?
Yes. No matter how much I sleep, I've been feeling very tired for the past few months. Along with this ongoing pain in my abdomen, I've been losing weight on my own recently.
That does seem like a problem. Have your digestive habits or appetite changed at all?
Yes. I've experienced a few cases of diarrhea, and my appetite has greatly decreased. Additionally, I occasionally pass blood in my stools, which truly scares me.
I can imagine. The symptoms that you have described represent important warning signs. Our tests seem to indicate that you have Crohn's disease. It is an uncommon form of allergic stool illness.
Crohn's disease? Though I don't know much about it, I have heard of it. For me, what does it mean?
Your digestive system becomes inflamed when you have Crohn's disease, which can result in symptoms like severe diarrhea, weakness, weight loss, and dehydration. Depending on the particular person, the inflammation may impact different areas of the digestive system.
Is there a treatment for it?
Sadly, Crohn's disease cannot be cured because it is a chronic illness that can only be managed. Still, many Crohn's disease sufferers can lead active, happy lives with the correct care and changes in lifestyle.
What kinds of treatments are available?
Usually a combination of medication, changes in lifestyle, and occasionally surgery is used as treatments. Drugs may relieve infections, reduce pain, and reduce the immune system. We will also need to address your diet and possibly identify any common foods that cause your symptoms.
That seems very difficult. How will I know which foods I should stay away from?
At first it may seem a little difficult, but we will work through this together. I will put you in touch with a nutritionist who specializes in Crohn's disease. They may help you create a diet plan that will minimize your symptoms while making sure that you receive the necessary nutrients. It can be quite beneficial to keep a diary about food to record your meals and your post-meal feelings.
All right, I'm capable of that. And medication? Are there any negative effects that I should be aware of?
Antibiotics, biologics, immune system suppressors, and anti-inflammatory drugs are some of the many kinds of medications we may take. There are a variety of possible side effects related to each type that we will keep a careful eye on. On the other hand, immune suppressors may raise your risk of infection, and drugs that reduce inflammation can cause nausea and vomiting. The least forceful course of action will be used at first, and will modify as necessary.
It makes sense in that way. Surgery was included. Should I prepare for that anytime soon?
When all other options have failed, or if problems such as fistulas or blockages happen, surgery may be considered. Not that we make quick choices about it. Firstly, the aim is to manage your condition with medication and lifestyle modifications. In the event that surgery needs to be performed, long-term relief can be gained very effectively.
Yes, I see. How's my daily life going? What effects will this illness have on me?
Being aware of your symptoms and causes is very important for someone living with Crohn's disease. As stress may increase your symptoms, managing your stress is also essential. The control of your condition will be greatly improved by a balanced diet, regular exercise, and enough sleep. Your symptoms might be under control at times, and they may come up at other times. Maintaining communication with your healthcare team and being active are key.
I thank the detailed explanation, but that's a lot to process. Being aware of my situation and the fact that it can be managed helps.
I know that sometimes it feels like too much to handle, but keep in mind that you are not doing this alone. Support groups and other resources are available, and we have a thorough plan in place to help manage your condition. At this moment, are there any other queries or worries you have?
Not yet, but as I adopt everything, I am sure I will.
That is completely normal. Please contact me if you have any questions at any time. In order to check on your progress with the first treatment plan, we will set up a follow-up appointment in a few weeks. At the same time, look after yourself. and make an effort to remain positive. Throughout the entire process, we are here to help.
Thank you, Dr. Alex. I really appreciate your help.
Thank you, Mr. Smith. We'll work together to overcome this. I'll see you at the upcoming appointment.